Hi, my name is Annette Crespo-Lewis, and I am a medical student at Wayne State University School of Medicine. Today, I'm presenting my project titled Improving Medical Student Preparedness to Screen for Human Trafficking in OB/GYN Settings through a Targeted Educational Intervention. As a brief introduction, human trafficking is a significant public health issue, and many survivors interact with the healthcare system while they're actively being exploited. Despite this, human trafficking is often not identified in clinical settings. Prior literature suggests that a major contributing factor is the lack of formal education and training among clinicians and medical trainees. This represents an important gap in medical education and an opportunity for early intervention. So why OBGYN? OBGYN represents a critical opportunity for identification because patients may present for reproductive health concerns directly impacted by trafficking, including pregnancy-related visits, STI evaluation, contraception needs, and reproductive coercion. These encounters may provide one of the few opportunities for private screening and early recognition. The objective of this project will be to evaluate whether a brief educational intervention can improve medical student knowledge and confidence in screening for human trafficking in OBGYN clinical settings. This will be conducted as a quality improvement educational intervention during the third year OBGYN clerkship. So the flow of this project will be a 30-minute structured educational session that was developed and will be delivered to medical students. The session will include the epidemiology and healthcare relevance of human trafficking, trauma-informed interviewing techniques, and appropriate response and referral pathways within the healthcare system. To evaluate the effectiveness of this project, anonymous pre- and post-intervention surveys will be administered. These will assess students' knowledge of trafficking indicators, self-reported confidence in screening and response, and perceived preparedness to manage a potential positive screen. The primary outcomes will include changes in knowledge and confidence, with secondary outcomes assessing perceived preparedness. Students will complete a pre-intervention survey, participate in the 30-minute educational intervention session, then complete a post-intervention survey. Responses will be compared to evaluate changes in knowledge and confidence. At the time of this presentation, data collection has not yet been completed and will occur during the upcoming OB/GYN clerkship block. We anticipate that the educational intervention will result in improved knowledge of human trafficking indicators, increased confidence in screening and response, and enhanced perceived preparedness to identify and manage potential cases in clinical settings. These expectations are consistent with prior literature demonstrating that brief, structured educational interventions significantly improve healthcare learners' knowledge and confidence in recognizing and responding to human trafficking. This figure on the right represents the anticipated improvement in knowledge and confidence from pre to post-intervention following the educational session. Overall, this quality improvement project evaluates whether a brief, targeted educational intervention can improve medical student preparedness to screen for human trafficking in OB/GYN settings. Given the frequency with which survivors interact with the healthcare system and persistent gaps in training, early educational interventions represent an important opportunity to improve identification and response. Ultimately, this work may support integration of standardized trafficking education into medical curricula and strengthen trauma-informed care practices. Thank you so much for your time and your consideration.